Well, hello, everyone, and welcome to the latest episode of HR Tech Chat. And I'm very happy to have with us today James Norwood, who is Chief Marketing and Strategy Officer for isolved. Welcome.
Hi, Brent. Happy to be here. Thanks for having me.
Oh, absolutely. The pleasure is all ours. Thanks so much for agreeing to do this. And a couple of things. So we're going to focus on something really interesting that isolved just recently did, and that is you folks launched a health and medical industry specific version of your People Cloud full HCM suite, and that's a pretty big deal. And I know we're going to get into that quite a bit today. But first, I just wanted to let our audience know that just a little bit of background on you. Maybe you could elaborate on this. I know that you've been in the enterprise software space for, I think, about 3 decades now. And so I guess a way of saying it is that you may have seen it all. So maybe you can just elaborate a little bit there.
Yes, I hate to actually admit to that, Brent, but yeah, I think I started my career in software in 1988. So pre the World Wide Web, pre mobile phones. I think networks were just starting to come out. So yeah, I've been around a long time, perhaps longer than I should. But yes, I've been through many different changes and reinventions. And one of the things that, of course, is always a constant in technology is change. So yes, excited to still be part of it.
Oh, that's great. That's great. I wish I'd been in my profession, various professions. I think maybe about 30 years now, or 25 anyway. But I wish I could say I've been in the same one for that time. So you have that going for you. I know that isolved, just to set the stage here, because they're to get into the meat here. The health and medical fields, especially over the past couple of years, but just in general, they have a lot of unique challenges. And I know that you folks have, and we're going to speak to some of those, but I know that you folks recently did a couple of surveys of HR leaders across many industries, and then a deeper dive into the health and medical field. And you found out some interesting things. Maybe you could share a few of those with us.
Yeah, no, absolutely. And, it's one of the driving factors for why we released isolved for healthcare services was the feedback that we saw amongst the survey results that we do with our annual, it was actually our second annual HR leaders industry survey, which was published in February. You can get it from our website. It's up there. But very interesting. Obviously, the last 2 years has been just so dynamic for every industry because, of course, of the pandemic. But healthcare has been at the, has borne the brunt of most of the challenges and changes that have happened, simply because it was a pandemic, and a lot of that was coming through in our survey. So just to give you an example, recruiting new talent was seen as 65% harder in the last 12 months than it was the prior 12 months, and for good reason. There may be more registered nurses than ever before, but there's a national shortage of registered nurses than ever before. And that led to 73% of the leaders, in fact, 100% in the assisted living area, where we're talking about care workers, finding talent retention was hard. So not only is it increasingly hard to find people, but it's very, very hard to hold on to them. And then a couple of other things which I thought were very interesting is around the financial aspects of this. Healthcare workers are missing shifts in greater numbers than ever before. And a lot of it is not just due to the burnout that they're having from being in ICU for the last 2 years. I shouldn't laugh. It's all credit to them. But 31% of HR leaders were attributing missed shifts to financial strain on their employees. And likewise, even though 85% of employees would like access and would, if they could, make use of things like earned wage access, on-demand pay and other financial wellness applications, only 25% of leaders in the space are actually providing things like that to help folks with work-life balance and better health and well-being. So it's really interesting to see some of these things coming up. And the last stat I'd give you is, not unsurprisingly, 78% of healthcare leaders are now focused on employee experience as a top priority this year.
Who would have thought, right? You know what, the one that really stands out to me is that so 100% in the assisted living space, I think it was you mentioned.
Yeah.
I mean,
Yeah.
how many times do you have a survey that were 100% of respondents? That's
Yeah, exactly. Retention, look, it's been COVID-19 was so tough for healthcare workers, and not just in primary care, but those that are going out and doing care in the community and working in care homes where once someone got it, everyone got it. It's been tough. So hanging on to those folks has been hard, and just having to go from one place to another to help out and to cover a shift simply because a care worker at this particular home came down ill or sick and therefore couldn't come into work. And so you have to cover that shift. There's a lot more financial hit to the employees because they're having to take greater expenses to maybe drive to a location they wouldn't do, and then they need to get reimbursed quicker. And and again, that becomes a challenge. So it's not unsurprising that people have been that healthcare workers have been a very large percentage of the Great Resignation or the Great Recalibration, however you want to call it. They're sort of looking at their lot and they're saying, maybe I should be going elsewhere. I don't know if you saw, Brent, but I read today a new study by Elsevier Health, and they're predicting a mass exodus of healthcare workers from the economy by 2025 of up to 75% of the folks that are currently there today. So by 2023, they're saying there'll be a shortage of around 140,000 physicians nationwide. So this is a real problem that's not going away, even if the pandemic does.
Yeah, I mean, imagine that the burnout is probably just absolutely fierce right now. You mentioned employee experience, and to me, and this is probably a good segue. Obviously, the providers, the solution providers that can really help these organizations in these fields address that employee experience are going to be the winners, honestly, in the space. And in what occurred, what occurred to me as you were describing that is that, again, is that this idea that the employee experience is, yeah, there are some things you can do with the employee experience. They're kind of soft and sort of empathetic, these kinds of things, but they seem empathetic, and they are, but there are other things that don't readily seem empathetic, but are, right?
Yeah.
And also affect the employee experience, like making it easier to process expenses, or
Absolutely.
making it easier to swap shifts and these sorts of things. And I know that there are some unique challenges or acute or exacerbated challenges in the health and medical fields around scheduling and some of these things. And maybe you could get into share with our audience a little bit about what the isolved people cloud for health care and medical services, how that I think I got that wrong, sorry, but how that addresses some of this functionality that these places need to provide a positive employee experience.
Yeah, no, absolutely. And first off, you're absolutely right. There is the softer side of employee engagement, but it can be as simple as getting expenses paid or getting access to your earned wages ahead of time. It's financial wellness, but it's still part of it. But yes, I mean, look, so isolved for Healthcare Services, to give it its full name for you, it came about because it's an area that's clearly suffering from not just from staff shortages, but even healthcare providers are struggling with meeting their financial performance side. So they're turning to look at cost efficiencies. They're looking at their tech stack. I don't know then the last time you went to the dentist or to a medical professional, but there's a Windows 8 system usually on the, in the background. It's all aging tech. And so there has been a lot of verticalized point solutions that existed, but trying to holistically put it all together for us was a way to help them actually reduce their costs, the healthcare providers to reduce their costs. And when we started to talk to our customers in the space, and it's around about 10% of all of our customers are in some form of healthcare, they told us in the early days, well, you're missing some of these features that we need, which is why we have these industry specific solutions. So we work very hard in conjunction with our customers to build out those things. And a lot of it is in the area of workforce management that's very specific to healthcare, to ensure that, okay, if you're using this point solution to do this, we now have those 3 features or what have you. But we went a little further than that, is not just building in the product features, and I can get into them in more detail, but also wrapping the package with a series of best practices, services, which we knew that we needed to deliver each time to make those customers successful. And so packaging them up and making them available as well. For example, around talent acquisition, just teaching them how to write better job descriptions, teaching them how to optimize for that content, putting in place in the package all of the healthcare specific job board connections, so that when they launch that job description, it goes to not just to Indeed and Monster, which is where most of them throw it up, but it goes to all of the places where folks are looking, and just helping them to get their story across better. So there's a lot of services as well as functional aspects to the product.
Yeah. Uh, Thinking about nurses again, right, and how difficult it is to capture their attention and get them to work for you as opposed to somebody else. They have so many options. It's really interesting how there's this sort of there are these two almost competing ideas going on right now. One is where there's this you have nurses who sort of have their pick of the litter of where they want to go to work next, and whereas at the same time there's a mass exodus where people are leaving the industry. That to me that's curious.
It's part of the problem. And so again, there are more registered nurses today than there's ever has been, but not all of them can get certified. Not all of them want to work in ICU. So it's the job pool doesn't, which has a shortage anyway, doesn't naturally fit with the types of work that's available. And if you're a healthcare worker today, not only are you in a better position to leverage better pay and better sort of work-life balance options and flexibility, but you're also in a position now to take more control of your own schedule. And healthcare providers need, if they want to retain that talent, they're going to have to do that. So a lot of what we did in the product was around sort of workforce scheduling, was allowed around people being able to bid on shifts or take over shifts from someone who was sick or a friend without even having to involve an HR administrator who's then going to call around or email around to try and find cover, because the system's going to say, you have the qualifications to do this. Do you want it? And they can just go take it, which is great for the business and good for them. So having, not just shift swaps, but being able to work out who's available, who's qualified for that was one big part of it. And another thing as well is just doing workforce scheduling around things like occupancy, like how many beds have we got filled, how many people do we need here, and using that to generate the demand, and then have people come in and say, okay, that's local to me, I can take that. So transferring more control back to the healthcare workers, which they haven't always had, is better for them too.
Yeah, empowering those employees. Yeah, I think is key. When nurses, just to sit on this point a little bit longer, when nurses and other types of employees that work in these fields have so many options because there are so many job openings and there's a relative dearth of the availability of the talent, what can the health organization do to say persuade
Yeah.
RNs to do ICU work as opposed to doing some of this more interesting stuff? Like, what are some of
Well,
the things that they can do?
there's a lot of things that, I mean, simpler things would be give them tools that are simple and easy to use, and don't stress them out. Help them get onboarded and trained, and I mean, with very strict compliance in this area, but help them with that so it becomes less onerous. Also support the remote workforce better. I said more control of their schedule is very important, but investing in health and wellness programs, even things like better childcare support, is, which isn't always there. So I just once you're in a battle for talent and the shortage, and it becomes a seller's market, then you do have to invest in these things. What is isolved doing? We're helping on some of those things, like helping people get onboarded quickly, helping them get compliant. So we have industry specific learning. Our learning management system has very industry specific certification training courses, which will automatically notify people in advance when a particular certification might be coming up to expire, and help get them through without it being a rush, to ensure that they don't get turned down for particular work then. So there's a lot of things that can be done to work with the employee to make them feel like they have, more control in their own destiny.
Mm. Some of this stuff sounds like it's perhaps transferable to other industries as well, some of this functionality.
Yeah, I mean, certainly a lot of the workforce management we've done, shift coverage, requesting other shifts, things that would apply to retail. It would certainly apply to hospitality. So it's not, we built it with healthcare in mind. That they were the ones that had some very industry specific solutions, but we found very quickly that those very same features where we're going to be desirable to other space. Like retailers know how to market their jobs; they're better at that. But certainly the workforce side of things, that shift coverage, reducing the manual labor from picking the right folks, just being able to see who's qualified or certified to do certain things, and transferring more control over to managers and employees themselves to apply for particular shifts and do that. Absolutely, retail and hospitality, who are both also undergoing staff shortages due to the pandemic, their benefit from it as well. So that the same functionality we've built in for that will surface up in our industry solutions for those folks when we get to them.
Yeah, seems wise to tackle the healthcare space first.
Yeah, it's the largest. We're winning the most business there, which tells you that there's a demand for our technology. Healthcare does tend to take more of the people cloud suite and packaging it up as as iSolved for healthcare services. They can certainly take it piecemeal as they go, but at least they have a roadmap now to say these are all the things that we see are going to help you, from talent acquisition through talent management, HR, payroll, workforce management in between. So they have this roadmap or this blueprint of best practices that they can follow. And these types of industry specific solutions, not the point solutions, the sort of human capital management industry solutions, you didn't typically find outside of the very big players that are serving the enterprise. So for iSolve to do this for small to medium sized businesses and mid-market companies, it's quite a new thing, and it's going to reduce their costs. It's going to improve employee engagement and the overall experience that they have of that company. So yeah, it's I think it's a natural place to start. It's got the most, experiencing the most pain, but if you crack this one, then it gets you a head start into other gray collar, white and gray collar areas.
Yeah, I think so. That's a great point. Did you? This is where the solution provider industry is going. Is kind of moving in this direction. Do you think?
Yeah, it's the way it should go. I mean, it's the hardest thing to do. If you think about it, like iSolve began probably more than 30 years ago. In fact, we came into being to help companies deal with COBRA when that became a thing back in 1985, which you could think of as a vertical thing. It's human resource issues brought about through government legislation. And that's kind of been everything we've done ever since, Americans with Disability Act came about. And then obviously, with COVID and all the legislation around that. So you could say that everything we do is kind of a vertical, but then to tailor it to an industry, it's kind of the last, it's that last piece that not many folks get to. And you can't do them all, I don't think. You've got to pick the areas where you're going to be strongest. So we're picking on where we have the most customers and where the most pain seems to be right now. So yeah, I don't think we're the first, and I don't think we'll be the last, but I do think our approach, which is not just a sales and marketing approach, it's product and services and best practices based on a lot of experiences is the way to go.
The services piece of it, that is very important, and it's what all the bona fide true full suite HCM providers are doing right now. They're providing those comprehensive services because you want your users to understand how best to use the solution, and users know their business, but at the same time they may not know all the best practices. And let me put this differently: a provider of solutions of technology for software for any given industry is going to have that perspective from having a number of users in this space that maybe the one user doesn't have. They know their own business, but they don't have that broader perspective.
Absolutely. And that's the very reason why we have at isolved, we have teams of tax specialists, we have teams of accountants, we have legal specialists, we have benefits specialists. And so when, and every customer that joins as part of our isolved for Healthcare Services bundle will get access to a dedicated customer service representative or team that they can go to for any tax or treasury question, any financial question, any benefits question. And that team is going to help them not just with the knowledge of their industry, where they probably got a fair bit themselves, but with a broader knowledge of overall legislation and requirements that they perhaps don't have. We provide, ACA compliance, FMLA administration, all of that is part of the bundle. Now that could, and COBRA administration, and all that can apply to a lot of industries as well, but it's our depth of knowledge there across every tax jurisdiction, in every state in the country that helps bring an added level of expertise to what they're trying to get solved.
Yeah. As a tangent, we spoke with a user of yours, Crescent Community Health Center, a few months ago, and just speaking to your origins in COBRA administration, helping with that. They just very recently, this past year, saying your praises at isolved around your ability to help them navigate some new rules around that. So you're still evolving even in that area.
Yeah, I mean, they're Crescent, they're part of the Federal Qualified Health Center program, which again is another example of, us serving health centers, walk-in health centers, community centers around the country. And they are all adding staff, they're all increasing staff, but they don't want to increase their costs, including their HR costs as part of that. So they are a good example. Yeah, I mean, COBRA is where we began, believe it or not, but we expanded into the full human capital management suite over a period of time. And Crescent's a good example of a customer that started with one part of the system and has grown into other areas, helping them with talent acquisition, as well as core HR payroll and benefits enrollment and administration and those areas. Yeah,
that's a great point. Whether you're in healthcare or in any other industry, frankly, as a small business growing, you have your acute, immediate, urgent needs in HR, which are around administration and getting things just under control, so you're not just overwhelmed by it. And but it's important at that point in time to be thinking about HCM more strategically, right from the outset. That's been our sort of observation looking at a number of users, is that when they think about HCM strategically from the very beginning, as opposed to it being sort of an administrative or an efficiency play solely, right?
Yeah.
Those organizations really set themselves up for notable success over the long run.
Yeah, I'd concur. I'd agree. And a center like Crescent, or CCHC as we call them, they're a community service that's looking after walk-ins. Regardless of their ability to pay, they're not going to turn anyone away. And it's anything from medical, dental to just regular health checks, or someone's got an emergency, they're there for them. And so it's quite sophisticated, it's quite complex, and it's changing rapidly. So it's yeah, I mean, they're a good example of someone that seems small from the outside. I think they've got only about 120 employees, but they serve 27 counties, and yet their level of sophistication from a human capital management standpoint is helping them to manage their costs and deliver those excellent services without having to increase, the amount of staff and the administrative overhead of handling it. And I read a statistic the other day. I think it was from the let me just bring that up. The HIMSS, which is the Healthcare Information Management and Systems Society, I think. And they said that 86% of all mistakes that are made in healthcare are administrative. They're not operational, they're administrative. And so it just tells you that they have an issue in the back end there. So it's, they have to invest. Technology doesn't fix everything, but technology that comes with good best practices built in will help them to grow their administrative side slowly, where they can still offer a very sophisticated solution to underpin the services they're offering. And that's, if we can do that, so it's not a bad thing.
Yeah, absolutely. Absolutely. Anytime that you can reduce error is a big deal. And if you can make any kind of a dent in that number, that's a high percentage. Yeah. Just the other thing that I love about this is, from a broader standpoint, is when you develop when somebody develops an industry specific HCM suite, it's a way for everybody to think about HCM more as a whole thing versus, we think about HCM so often as it's, it's discrete domains, or, it's silos, and that person has a performance management, needs a performance management solution, or that person needs a scheduling solution. I think it's still, when you think that way in WFM, maybe still it makes a little bit more sense. But what I love about these industry solutions is that it really gets it gets everybody thinking about HCM more holistically, because every business, or every industry at least, is different. It's not everybody has a performance management need. They have a more of a this is where I'm not quite sure how to describe it, but it's a way to break free from that conventional thinking that's, that was useful maybe 10, 15 years ago, but maybe we're kind of moving away from.
Yeah, no, you're absolutely right. And look, I mean, the healthcare industry, it's full, like most industries are, of a lot of point solutions that have been acquired over time, and then badly integrated or good, well integrated or not, that becomes over time it becomes a mess, and it's siloed systems that you have to learn each one differently. They look differently. I mean, the whole idea of having an industry specific platform is say, like, I move from one area to the other and it all looks and feels the same. That immediately takes off a massive overhead from the people that are using those platforms, that need to use them to do their jobs, to get productive, to get compliant. But it also reduces a ton of complexity and cost in the back end as well. And so, yeah, it is a opportunity to look more holistically as HCM as a solution rather than as a series of point solutions. But there's a reason that people went out and bought those point solutions. They weren't given the budget, or it was very specifically that met their need. It's only more recently that solutions like isolved for healthcare services has come about to say this is a broader suite now that introduces things which you maybe even didn't think you needed, that are part of HCM, but they're delivered to you in a way that's going to make sense to you and your business. So, performance management being part of that. So, yeah, maybe our product isn't as fundamentally as deep as every single point solution they acquired, but it's probably gets them most of the way there, and the benefits they get from it all being on one platform with all the related services and being easier to use and probably lower cost to operate outweighs that.
Yeah, yeah, well put. It'd be interesting to see where things go in the next 10 to 20 years. And maybe that's a little bit too far out, but how far away we're able to get from that sort of initial original sort of silo thinking to more of a maybe a completely different calculus.
Well, this is a problem that's not going away. We're doing telehealth now. There's, patients are more empowered. Everyone goes on WebMD, then calls up and says, I think I need this, and I think I need that. The transition to home-based care. And of course, the elephant in the room, not your good self, because you're a young man, Brent, but the aging population with incremental healthcare needs is not going to go away. So this is a problem that's here to stay. And so I think it's important for companies like isolved to take it seriously and play our part and do what we can to help remediate some of those issues.
Yeah, yeah, absolutely, absolutely. This has been a fantastic conversation. Thank you so much for joining us, James.
Thank you so much for having me. I love chatting.